right, today we're going to check out the NBC News live stream regarding this coronavirus. And this is on April 1st, 2020.
Also a squeeze going on the other side of this. Charities say that because there's so much economic misery, they're finding it hard to get donations. Everybody's competing for the same dollars and the same resources, so things are getting tight. We know that
Important. A lot
across
of
the
people
country,
collecting donations
especially
right
around
now.
the first of the month, there are record numbers
Pay
of people
attention
filing
to
for
who you're giving
unemployment
your money
benefits,
to.
visiting food pantries, looking for help. Here, they think they have enough food for about a week or so. They give out at breakfast, they give out a sandwich, a piece of fruit, a drink, some coffee. Lunch is much the same. They're doing the best they can. They're also finding it hard to get volunteers to come down here because so many people are sheltering in their homes. Again, they know what they're doing this week. They're here trying to help. Next week, they're not so sure what that might bring, like just about everybody else here in New York City. Allison?
All right, so that was a poverty line in New York
What is it like for nurses on
City.
the front lines of the corona crisis in New York City? NBC investigative reporter Chris Glorioso talked to a nurse who's working night shifts about what she's seeing in her hospital.
This is too much. I don't know how much longer I could do this.
Sheena Tannis is a Brooklyn critical care nurse who agreed to show us what an overnight shift is like, treating only the worst COVID-19 patients. These New Yorkers are not just on ventilators. Many are on dialysis and countless medication drips, too. She's the one watching them all night.
It's 10 p.m. I'm heading in to give medications to my COVID patients.
Why are you on social media?
So
if y'all so busy, why are you on social media?
But it's important that I keep myself protected in order to take care of them.
Tannis works at Brookdale Hospital, hard hit by COVID, with a refrigerated box truck out back. It's a temporary morgue.
Why do they keep pushing
these
types of
sits in an economically depressed community.
They want
Tannis
you to
says
feel
many
terrible.
of her patients have the risk factors that go along with that community.
What did they need to
Asthma,
tell you that for?
diabetes, and heart disease.
It is 11:15 and I'm still in the room with the patient, doing dialysis. I'm managing drips.
What patient? You ain't showing no patient.
Managing
ain't nobody in that bed.
It's not easy.
It's not easy to manage these critically ill patients and not easy to manage one's own anxiety.
There's nobody in that
During
bed.
her overnight shift, Tannis told us there is constant worry about the risk of nurses becoming infected themselves. They don't dare take off PPE.
This is a sweat that came off of me while I was in this room.
Why is she always making videos, man?
It is extremely
Every moment she's uploading.
For the rest of the night, the Brookdale Critical Care Floor was too busy for Sheena Tannis to record more video diaries. She didn't press record again until the next afternoon, as she got home to her two kids.
Until the next afternoon.
It's 12:19, and I just parked my car coming home from the shift. My face is breaking out from the mask. I look like I've aged 20 years.
Okay, this is acting, y'all. This ain't genuine.
This is too much.
Why are they doing this?
I don't know how much longer I could do this.
Why? Why are they doing this?
We're here for them. We are the community.
It's definitely good to hear. You always want to hear that the wages are going up.
We work hard, we bleed, we sweat, we cry when it comes to these cars.
Without this pill, we die.
He's doing the best he can for the country, and they're getting in the way.
We're going to build the wall. We have no choice.
This is an emergency. There are 0 hours left to take action.
Because we're incarcerated doesn't mean that we should lose our right to vote.
This is the perfect time to graduate.
There's like a lot of shooting.
All this for a damn political
ad. These are thoughtful voters who, more than anything, want these candidates to cut to the chase.
Time, man. 2 more minutes. Goodness gracious.
NBC Nightly News with Lester Holt, covering coronavirus with facts over fear.
How do we know who belongs in isolation? What should we be conscious of? What's being worked on today?
At a time of national crisis, turn to the most trusted TV news anchor in America.
Most trusted. Get the fuck
Need
out
your
of
true crime fix on the go? Dateline episodes are available as podcasts. Mysteries with a twist.
Why they always make
from
the
the
ads
True
so much
Crime
louder
Original.
than the actual
Wow.
content?
Listen to Dateline
Real,
wherever
man.
you get your podcasts.
You're watching NBC News Now. We've got some breaking news. This is all I've got left.
Who brought more to the caucuses?
It's news made for your streaming world. Live weekdays, 3 to 11 p.m. Eastern.
Man, I'm telling you, these news organizations really try to play into the emotion of people, and it works. That's the sad part. So much programming and manipulation.
Good evening from Las Vegas. Manchester,
Don't trust this motherfucker?
Why should your judgment be valued?
I'd stake my judgment against anyone out there.
Is
You look like Joe
party unity
Biden,
your
man.
concern right now, or is simply winning as many states as you can?
It's both. NBC Nightly News with Lester Holt.
If it's digging in on the issues,
let's talk about money and politics.
if it's asking the questions you want asked, how do you reassure those supporters that you will sustain this?
Just watch me.
If it's navigating the winding road to the White House, and if it's Sunday, it's Meet the Press.
The coronavirus outbreak. What's next? NBC
they
News
turned
has
this up
in-depth
even
coverage,
more.
answers to your questions, insight from medical experts, and up-to-the-minute live blog updates. For continuing coverage, turn to the networks and platforms of NBC News.
240,000 Americans could die from the coronavirus, even with strict social distancing measures in place. So how can you protect yourself and protect others? NBC News medical contributor Dr. Kavita Patel joins me now. And Dr. Patel, 100,000 to 240,000 deaths is the best case scenario according to the White House
Listen
task
to these
force.
people.
Could you explain that for us?
Listen to the fear, man. The images they're showing you.
Fact of the matter is that the estimates come from not just, how many people have been tested, how many folks have been positive, but also we're getting data daily now from all states. So the model is actually kind of being adjusted, and that 100 to 200 is probably the best estimate based on testing that's available, kind of the social isolation measures we have to date, what we're calling the attack rate, how often someone gets sick if they're exposed to the virus, and how long it takes to recover if you recover, meaning if you're in the hospital and you don't die, what does that look like? So it's pretty sobering. But
Pay
I'll tell you,
attention to
Allison,
how
it's
often
better
they
than
change
some of the other statistics around
the
2
so-called
million, which you
statistics
probably
around this
recall have been
disease
floated before as well.
or this virus.
Yeah, absolutely. That's a dramatic difference and an improvement, even though those are scary numbers. Let me ask you this. The director of the CDC says that up to 25% of people who have coronavirus aren't showing symptoms. Knowing that, what should our strategy be to fight this disease going forward?
Great question. And the best piece of advice is to stay home, because even if you are what we call an asymptomatic carrier, you will not infect others if you are home. But you are also hearing, Allison, a lot more interest, even by the CDC and Dr. Tony Fauci, to look at whether or not we should be wearing masks. And I'm not talking about the kind of masks that I need to wear in the hospital or the clinic, but some form of like a bandana or something you could make with some guidance. I will say, though, do not let that offer you a kind of a false sense of security. A mask is really only to prevent others from getting sick from you, kind of to your point about being asymptomatic or not having a cough.
Okay, so then why does everybody need to wear a mask if it's only to keep you from getting other people sick?
Just practical advice to any viewers: stay home, wash your hands often.
Stay home.
But as you mentioned, if you are in this population where you're wondering,
until the end of April now,
and you
that they
can't
don't
get
want
tested, the best thing you can do is to treat yourself as if you could give it to others and be very careful about what you're doing.
And ramped up. All the so-called statistics are changing. The numbers keep changing.
Let's talk about wearing masks a little bit more, because this morning the Surgeon General told the Today Show the CDC is reviewing its guidelines on wearing masks. Do you think the general public should be wearing them, or even some homemade form of mask like a scarf or bandana, like you said?
So first and foremost, I think we need to do exactly what I said earlier, stay home. However, if we look at other countries where we talk about wearing masks and social distancing and having, precautions like stay-at-home orders, that is where we see the effects of a community-wide kind of mask use. I think the more practical idea is that as we try to transition back to work, back to a more regular life, that we will have some form of recommendations around, let's call it a face mask of some kind. But again, the critical piece here is that a mask only protects
you better not
other
leave your
people
house
from
without
you,
a damn
not
mask.
the other way around. And that's why it's getting so much attention right now.
The national social distancing guidelines have been extended through the end of this month. And I think in some people's heads, they might think, oh, great, end of the month. That could be the end of this. When do you expect to see the peak of the coronavirus? And do you think that there's a possibility that deadline could have to be pushed back?
I do, Allison. And I think I've kind of talked about this with you before. I would love to see all of us resume life as normal in May 1st. However, I think it just mentally, we need to set ourselves for expectations. And if you look at not just the models, but just like you talked about in New York City, it's going to take several weeks to see the peak. And then we're going to want to see those numbers coming down. So I do predict we're going to extend into May. However,
they're already
I do
wanting to
also
extend
think
this
that by
into
then
May,
we'll have a better strategy around testing,
and they always,
so that people
by
can
then
know
we'll be
if it's
able
safe
to
to go
better
back to
know,
work,
and it always
and
gets
a
extended.
plan so that we're not just feeling like we're going to open our doors and be exposed to the virus.
Hurting,
but I do think viewers should brace for this to go
unless
beyond
they
April 30th.
rise up and start using their own individual minds.
We keep talking about this peak as though the peak will happen and things will be better after that.
Yes,
but as you mentioned, obviously, after we see the peak, we'll need to see sort of a decline in cases. Do you think it might be sometime well beyond the peak before conditions actually improve?
Usually what we know about peaks is that there's usually a pretty decent drop off. If we look at data from China, for example, all in, it took 2 months of kind of the most strict social distancing. So I do think that it's optimistic to feel like when we hit a peak and we see those decreases in numbers, that can happen over, weeks, not months. So I do think that life will resume. However, again, it's all going to have to be based on looking at what we do to get back to normal. Even in parts of China, Wuhan included, kind of economic activity, regular life has not completely resumed to date. So I think we're going to have what I'll call a new normal for several months.
New normal, and that's
another
then we can
term
feel
that keeps more confident about getting together in large places.
It's a new world order. It's a change from what the old systems
it seems
were,
like a lot of people are going to need to ease back into that. We've been talking throughout the day about what will it take, when will people want to go back to bars again, get on planes again, and I know a lot of people will be skittish about that for some time. Dr. Fauci said yesterday that we are starting to see some results from social distancing, but that we still have a long road ahead. I'd like to play that.
What are the results?
Now is the time, whenever you're having an effect, not to take your foot off the accelerator and on the brake, but to just press it down on the accelerator. And that's what I hope
and I know
that we can do over the next 30 days.
Dude wants us to drop
So how do we know when social distancing is actually working? Are there certain signs that you look for and say, how do we know when it's time to ease up? Does this go back to that? You want to see a drop in cases?
Yeah, and there's a lot of kind of mathematical kind of phrases. You've probably heard about the doubling rate, the R naught. So basically we're looking, Allison, bottom line, we're looking for a longer period of time for the cases to, quote, increase. And that's really, down to the level. I've been tracking cities by each day. And I can tell you right now, we're seeing some promising signs, for example, in Boston, Massachusetts, where we are seeing a slowing effect. But I can't emphasize what Dr. Fauci said enough. Now is not the time to put the brakes. It's time to put the metal to the pedal and just keep pushing that out, which is why I think you saw the Florida governor, after all this time, finally doing what I think the entire country does need to do.
This is what they wanted the whole time.
These kind of stay-at-home,
they wanted all the big
essential,
cities, the big areas, to be put under a mandatory stay-at-home order. And people are calling for this and supporting
As you
it.
mentioned, we saw the Florida governor finally put a stay-at-home order in place. Do you think it's problematic when we're seeing throughout the country sort of this patchwork strategy where, all states aren't working in tandem and working together?
No, it's problematic that someone thinks they can tell you that you must stay in your home. That's problematic.
It can, Allison, and I think, Bill Gates wrote a brilliant kind of op-ed in today's Washington Post where he basically said exactly that, Allison. We have to have national, and it's hard in the United States. We love having this kind of balance between federalism and what the states can do, but now is not the time. We have to get on board all together, send a clear message that our health and the health of our country is the most important.
Wow.
And only then are we going to be able to nip this virus in the butt. This virus is smart. This virus is deadly. And we have to take the same approach all throughout the country.
No, we don't.
Dr.
That's
Patel,
collectivism.
You've been such a great resource for us throughout
Each individual has the right to choose what to do with their own body.
Thanks for coming back again.
Thank you.
Georgia is one of the latest states to announce a stay-at-home order as cases there continue to rise. NBC News correspondent Blaine Alexander joins me now. And Blaine, what can you tell us about Governor Kemp's decision?
This is the decision came down in an hour or so. Georgia, as you know, was one of about a handful of states here that did not yet have a statewide stay-at-home order. You've seen it pop up in counties and cities all over the state, but not statewide. Within the last hour or so, he just announced that he's enacting it. So
from a local level,
there's going to be a statewide stay-at-home order. It's going to be in effect until about April 13th. And then it is, and that coincides with the state's public health emergency declaration. The other thing is he's going to cancel schools for the rest of the year.
County, and now
schools. Now, the interesting thing about this, Allison, is that watching this news conference, another reporter who was at the governor's news conference asked, why are you enacting this now? And Governor Kemp said this several times, and he pointed to what he described as new information or new guidance that people can spread and transmit this virus, spread this virus before they're showing symptoms and before they know that they're sick. That's what he's pointing to as his reason. And he says that he and state health officials called that a game changer. Now, of course, that has been one of the big components of this virus and what has caused a lot of other jurisdictions and people to say stay inside, even if you're not feeling badly or showing symptoms. So again, that's going to go into effect Friday and remain in place for about 2 weeks as of right now, Allison.
I know you were just in Albany, Georgia, which is leading the state in cases. How are they handling the outbreak there?
Well, first let's talk about Albany, Georgia. So this is a place that is the county itself, Dougherty County, has about 89,000 people or so, give or take. So a relatively small county in Georgia, but it has the highest number of deaths in the state and the second highest number of cases. So those numbers are even higher than some counties that are more than 10 times its size. So this really points to you just how devastating it is down in that community. In fact, just a couple of hours ago, I did a Skype interview with a woman who is now recovering from coronavirus. And she told me that being down there, it's almost impossible that it hasn't impacted either you or somebody you know in some sort of way. When I interviewed the mayor yesterday, he told me that they had a city worker who recently died of COVID-19.
Or anyone
so
I ever
it's
asked.
certainly hitting Albany hard. But
ask anybody you know if they know someone who has died from coronavirus
health officials are looking at the origin coming from a pair of funerals
that happened, and then kind of the
church services thereafter, and say that a number of the people who came in were either associated with that. The woman that I spoke to on Skype was in that same church 2 days later and got a phone call and said, hey, you might want to get tested for this. And that was kind of what led to her case, she believes. So you're seeing it come from a very targeted origin. But down there in Dougherty County, there is only one hospital to treat really the entire area. I talked with the people at Phoebe Putney Medical System. They're doing a fantastic job. They had about 6 months worth of supplies stockpiled, just put away in case of emergency. I'm told that they blew through that in a matter of days. And so, the beds, the capacity, they reached capacity. Some people had to go more than 100 miles away to be treated. So certainly a lot of the issues that we're seeing in bigger cities, but smaller towns, fewer resources to fight back, Allison.
I'd like to ask you about another southern state that's in a similar situation. We know Louisiana suffered its largest single-day increase this week. The governor there saying the state will run out of ventilators by the weekend. How are they combating the spread of coronavirus there?
So the governor in a news conference today did give a bit of good news. He said that they got a shipment of about 150 new ventilators that came in. Those came in ventilators that they had requested. But he says still that's not enough. When they get to the point where they're running out of ventilators, that's not going to be anywhere near enough. So there is still a great deal of concern down there. The numbers there are astonishing and have been astonishing. I spent the better part of a week of last week there reporting on this. And what we've seen.
My question is, how do you verify these numbers?
Are numbers that are increasing
when we know they
faster than they were last week. So yes, it's
the financial system by putting numbers,
but really it's just how quickly
on a screen.
Those numbers are rising. 1,212
say these numbers that they're putting on your screen
yesterday,
fake.
just under that amount today. So we're well topping 6,000 cases
there's
statewide.
No verification. There's no transparency to it.
Many of them concentrated.
If this process is hurting the whole damn world, there should be a lot more transparency and decision making among the masses.
If it's digging in on the issues,
let's talk about money and politics.
All right, so we're gonna stop it there. I'm not gonna pay attention to this damn ad. But yeah, so like I said, today is April 1st, 2020. They've extended the stay-at-home nationwide order and guidelines up until the end of April. So April 30th, they issued a stay-at-home statewide order down here in Florida. Governor Ron DeSantis issued. It will start tomorrow, April 2nd at 11 p.m., I believe. So just wanted to get in that. Pay attention, man. These people are just giving you stories to manipulate you, and there's no transparency. We don't know what to believe. We have to continue to do our research and be discerning. And everybody stay safe, man. Y'all take it easy.